we established first liver pancreas surgical team in National Cancer Center. While we are treating, I'm a doctor, but while I'm not treating and I'm taking the pen and writing, I should be the public health person. What I have learned is that just being surgeon is not enough.
Hello everyone, welcome back to OncoDaily. Today it's a great honor and pleasure for me to welcome Minister of Health of Mongolia, Dr. Chinburen. Thank you very much for your time and for having the opportunity to interview you. Thank you.
Thank you very much for the invitation. It's a great pleasure.
Likewise. I'm going to start right away. So you grew up and studied in Ulaanbaatar during a time of major change in Mongolia. What inspired you to become a doctor?
All right. So I experienced from the socialist system, from the communist time to change it to democratic system. During that time, it was just my graduation of the high school, and including to the School of Medicine. So during that time, to the inspiring of to be the doctor, it was my grandmother. She experienced the cancer of the uterus, and she suffered very much, and it was the very difficult time for our family, and it was very stressful for us, and that's the make me to think about to be a doctor to treat the oncology disease, especially.
Yeah, so from the beginning, you had this desire to become an oncologist, and you pursue career in the oncology field, right?
That's right. Yeah, and also during that time in my teenage, I've seen the movie of Avicii from the Arabic, the first very famous medical doctor who wrote many important medical textbooks. And the movie about the Avicii was also that inspired me to be a doctor. It's not just healing the body, it's also the healing the mentality, and also the giving the good wellness to the others. It's very important, and it was also the big push for me to decide to be the medical doctor, and especially for oncology.
You studied and trained in several countries, from Switzerland to Japan. How did those international experiences shape your vision of healthcare in oncology in Mongolia?
My training for surgical residency, it happened in Switzerland, in Lausanne University, and I did my training residential program in Iverton. It's a small city, and I worked in a general hospital, and I met many great people, and they trained me well, and they give me the chance to learn all the Western medicine, especially on surgery. And during the time for Mongolia, we had economically we were very difficult, experienced a difficult time, and also for the Mongolians to study abroad, it was the big challenging, and it was great to see the big libraries and the nice textbooks, and working in a very difficult, the very different circumstance. It was very inspired me. And doctors, especially Dr. Smith and others, Swiss doctors, they had a big activity to train Mongolian surgical doctors. And they came to Mongolia many times, and they trained us. And also they give support many the surgical disposable things, like even we didn't have gloves during that time. The shifting from the communist system to the democratic and the free market society. It was a very challenging for Mongolia, and it was like an opening eye to see how other Western world is have this big achievement on surgery, and they're using so nice devices, and that they have a good technology, and they all services was so amusing for me. It just opened my eyes, and then
You
yes,
returned back.
yeah,
Yes.
I turned back, and so I've learned general surgery in Switzerland, and then I had the chance to have a training in Australia, in Austria, and also later when I became the uh, surgeon on a very specialized for the liver cancer and the pancreatic cancer, and it was I had the chance to have a training in Nagoya University in Japan, and it also was the very interesting to see how we can work very precisely on a surgery of the liver and pancreas, and also it was the another experience, not just for the general surgery. It was a very specialized training, and also the Japanese team, especially in Nagoya University, they have a big achievement on pancreatic surgery and the combined surgery with the liver and pancreas, to seeing the operation lasting for 12 hours and healing very difficult cases. It was very challenging, and I was very inspired to seeing this achievement of aggressive surgery for the cancer. And I've learned many things in Japan. And, so the level was different. In the Western world, I've learned the general surgery, and in Japan, I've learned very specialized pancreatic and the liver surgery.
And then you are back. What were the biggest challenges for you when you were back to Mongolia?
Well, I'm a very lucky person, and I think that God sent me the good teachers to taught me the liver surgery. And this person is a Frenchman. His name is Professor Michel Gillet. He came to Mongolia in 2004, and he came to National Cancer Center of Mongolia and did the first very difficult major liver surgery, which we never performed in Mongolia. And first time I've assist for this great man for the first liver major resection. And he also asked me to join for next operation in Mongolia, the National Cancer Center. And he said, okay, I will teach you, you teach others. And after that, from the 2004 until now, he is now 90 years old, and he came one time a year, sometimes two times a year, and like a personal trainer. He gave his old knowledge, transformed to the Mongolian source, and I was his pupil for this training. During that time, we had very difficulties for liver cancer because the liver cancer was the most common cancer in Mongolia. And many people came in a very difficult in a late stage. And, when you're saying to the patient, I cannot treat you, you go home. That's a very not good thing to tell to the patient. And the patient always, they crying and they no help. And then it was very challenging for me I'm trying to stop to telling these sentences to the patient. And it was very challenging to train myself in a better way to treat all the patients coming to National Cancer Center. And that was my dream, to have a team which can treat all the liver cancer patients and all the pancreatic cases, not sending them to other countries. So after the Professor Gillet came to Mongolia, sometimes it's also we are experiencing some difficulties for some liver cancers, and always the surgery is not God. and we can help to the patients if it's possible. If not, it's very difficult. And during that time, from the 2004 to until 2007, it was my learning of liver surgery. And after 2008, I learned the pancreatic cancer surgery, and we established first liver pancreas surgical team in National Cancer Center. It was my the big first step to fight with these kind of cancers.
You have received numerous distinctions and awards like Best Young Physician, Polar Star, Red Banner of Labor, Merited Physician of Mongolia, and then you became the director of the National Cancer Center. And I mean, first of all, what these all awards mean to you professionally and personally, and how it was that like this career changed to the director of the National Cancer Center?
So my initial the goal is not to become the director of cancer center, and I just wanted to have all the possible treatment be set up in Mongolia. And of course, when you send a patient to other countries and you say the treatment is not possible in Mongolia, it was very shame for us. And to start all the possible treatments in Mongolia, it was very challenging. And I had all people from the professors from all over the world, they helping me from the Switzerland, from France, from Japan, from South Korea, and from India, in the American doctors. They came into Mongolia many times and teaching us for all the skill of surgery. And what I have learned is that just being surgery is not enough. We need to fight with the etiology and the cause of the disease. And the liver cancer is the most common cancer in Mongolia, and the cause is that hepatitis B and C infectious is very spread out in Mongolians. It was the cause of the liver cancer. So to being just a surgeon, it's not enough. So we need to fight the cause. So for fighting with cause, you should be also the public health person. And so while we are treating, I'm a doctor, but while I'm not treating and I'm taking the pen and writing, I should be the public health person. So that's motivated me to be the leaders for the to make more awareness to the political people to fight against the cause of cancers in Mongolia. So it was also another challenge for me.
And then you made a decision to go for the public service, right?
That's right. And so I on public some programs. And in 2016, we start the Healthy Liver for Mongolians program, which was initiated with the NGOs and the doctors and also political people. They took attention on this problem, and the government extended some budget for this, and we started the fight against eliminating of the hepatitis C virus.
And coming back to your own career, you went to the parliament, and then you became the Minister of Health. Transitioning from clinician to parliament and the Minister of Health, how is it?
Well, it's also the challenging, and it's very interesting. So the reason why I became the General Director of National Cancer Center is that to start liver transplant program at the National Cancer Center, and I had the dream to start this program since 2011, but I established this program in the National Cancer Center just in 2018, after I became the General Director. And to start this very challenging program, we need to have a power. The power of using all the resources, all the human resources, all the financial resources to start this program. And we started successfully in 2018. And after that, the making participating on policy making that brings the big change. Was my feeling that if I can participate on a changing of the law on a health financing, on a health public health, on a law on the health, then the doctors, nurses, and even the patients can benefit from all of this. So that steered me to change from the doctors to political position.
And what are your top priorities? You mentioned already the liver cancer, you mentioned the financing problems, and in general, what are your other key priorities which you wish to? I mean, I wish you are like longer in the position of the minister, but one day when you decide to, retire from the ministry, what would be your that you would feel, oh, I'm done with this? What are your top priorities and dreams?
Okay, so all the ministers of health in every country, the main goal is reduce deaths of the disease from the disease, and that's the main goal. And for this, I'm running the important project, and I hope after 3 years we will have a much success on a unwanted death, on a preventable death. That's very important. Second is the for public. It's no matter how much you have money, you should receive the treatment. You should be cured. And what is your level in society? It's no matter. You should be cured. So these are very important, and this is also my dream. So in some countries, after experience of disease, they became poor. They're spending a lot of money for the treatment, especially for oncology treatment. It took too long and spending a lot of money. So in Mongolia, I would like to change this. And we are now for the oncology treatment. It's a free of charge. For organ transplantation, it's a almost free of charge. It's a very small amount of money. Patient, its co-payment is very small. And third is bring all the new technology in Mongolia, not in the last. It should be in the same time as a very developed countries. So the Mongolians shouldn't be behind of the technology. So we are a very small population, around 6 million in the big country, in the very vast country. So every corner should be occupied by Mongolians, and they should have a good medical service. That's my first goal. And after that, I will be good. And after my political position, I would like to continue my medical careers. And until retire, I would like to be the doctor's again.
Are you still doing some surgeries right now? Do you manage to do?
So it's my second term of the parliamentarian. As a parliamentarian. And before becoming as a Minister of Health, I did my surgery as a teaching professor. So I teach to young doctors for the surgery. And when I'm a member of parliament, it's allow us to teach. But when became minister, I cannot continue.
You cannot.
But in just 3 weeks, in end of the December, we start the robotic surgery. And I was a consulting surgeon for this operation. First robotic surgery in Mongolia.
Congratulations.
Thank you. It was very challenging.
Mongolian doctors are quite active and where do you see the role of Mongolia in the international health community?
The medical system is very centralized in Mongolia, especially for oncology. Almost 90% of all the cancer patients coming to National Cancer Center. So we are collecting big data for the oncology, especially for the very common cancers like liver cancer. So I did many liver surgery and maybe over 3,000 operations just for liver surgery. That's a good experience. And I also teach a doctor to other countries like Kazakhstan, like in Russia. And I'm trying to share my knowledge to others, my experience to others. As I mentioned earlier that my teachers say, I will teach you, you teach others. So I'm trying to continue this experience to others. And all this knowledge should be distributed to others. And it's always pleasure to doing this. And also, we are a nomadic country, and our culture is very nomadic. And from the Genghis Khan, we have a big history of our empire, and then we had difficult periods after this, and so the nomadic cultures gives us like a kind of the ability to quick learn. So the Mongolians is quick learners, and I believe that we have quick learners, and our climate is very different, very contrast. So to survive on this very severe climate, we should have a good resilience behavior, and so we have a ability to survive.
What is key to your success? Your own success?
So I would say is patience, and the big motivation to learn. And even I had many very attractive invitations from the private hospitals to offer me the big salary and nice career, but I always denied. No, I need to start the transplantation. I need to start other technology to bring it to Mongolia. So this kind of to being the integrity is, I think it's important. In legacy.
Then I'm asking the next question. What advice do you have for the young generation?
It's important to be honest to yourself and not distract with many other ideas or other subjects. Be clear and go to directly what you're going to achieve, and be honest to yourself. It's very important. Being honest.
What is the most important trait for a doctor, in your opinion?
So I established the HPB department in Mongolia, and I took all my young doctors myself. And the criteria to selection of the young doctors was first is to coming on a weekend to see a patient. That's a very important criteria for surgeons, not just working in weekdays and disappearing on a weekend. It's not good for doctors. Second is a language. If you don't speak in English as a global health language, then you cannot read the good articles and you cannot update your knowledge. So the language is second. And third is to be honest. If you did mistake, always tell the professors. And honest to the patient. Honest is a very important character of the doctors, especially for surgeons. And when I operate with my assistant young doctors, I feel their breath, how they're breathing. Sometimes its operation is continuing. It's not always sometimes occurs the difficult things. And then your blood flows and then you start to shake. So the surgeon should be very patient and very calm. It should be calmer.
What is the book or are the books which made a big impact on you, if there are any books you would recommend everyone to read?
So I will, the Dalai Lama, as you know that, right? Dalai Lama. Yeah, and his book of patients. It's a very important book, and there are some sentences. The people asking Dalai Lama. Okay, so in the world, many religions, and what religion is the best, or they are the important religion you think so? His answer is that in the world, many drugs. There are no universal drug to treat all disease. So all religions have a own benefit, own best things. So the same as a drug. So, and the person should be very wise and understand the others' willing, religion, and gender, and doctor should respect the patient as his mother, his father, or sister, brother, whatever. So that for this philosophy makes me also very patient.
Thank you so much. And, this year we are coming to Mongolia, the SIOP
Oh,
Asia. We'll
oh.
be honored to have our Congress there. And one of your key team members is chairing the local organizing committee. And we are very honored to be there. I'm sure it's going to be a great event. The Asian Congress of SIOP, International Society of Pediatric Oncology. So the whole community is really looking forward to be there. And I'm gonna ask my last question, which I usually ask to my guests. If there is one person you would recommend to interview, who should it be next?
I would like to propose Dr. Price. He's an American doctor. He lives in Utah State, and he worked for 20 years in Mongolia to teaching laparoscopic surgery. And I think he have seen how the one team can change the medical technology during the 20 years. And I think he would talk many things about Mongolia, and he knows what was our initial level and what we're doing now. And I just told you that we started robotic surgery. So it was the long, sustainable effort to teaching one country, and it brought the old technology of the laparoscopic, thoracoscopic surgery to Mongolia. And now in every IMAC, we have 21 provinces, all has a laparoscopic approach for the first surgical service. And it took 20 years.
Congratulations. And thank you so much. It was a very interesting discussion. And thanks for having a time in your busy schedule.
Thank you very much for this invitation.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.